Okay, so today I'm going to be demonstrating an intramuscular injection into the deltoid. So what's going to happen today, Stacey, is I'm going to give you a little injection just into the top of your arm here. It's going to be a little bit stingy, but it will only take a few seconds. Are you happy for me to carry out this procedure?
Yep, that's fine.
Awesome. Okay, so the first thing I'm going to do is I'm going to get all of my gear ready. So I'm going to grab myself out a drawing up needle, I'm going to grab a syringe, and I'm going to have my gauze here ready, and alcohol wipe, and my sharps container nice and close. So to measure the size of needle I require, I'm going to expose the area here. I'm going to squeeze the muscle and measure half the length. So I'm happy that this needle here is the right size. So I'm going to get my solution, which is sodium chloride solution, and I'm going to do a quick drugs check. So I've got sodium chloride, it's a 0.9% solution, there's 10 mils of it, and it expires in May 2019. Now normally I'd get my offsider to check this drug, but in this scenario I'll just ask my Stacey to do that for me.
So it's sodium chloride 0.9%, there's 10 ml of it, and it expires May 2019.
Thank you. Okay, so now I'm going to grab out my syringe, attach my drawing up needle. So I'm going to draw up 1 ml, remembering that the maximum amount of fluid which can be injected into the deltoid is 2 ml. So now I've got that, I'm going to give it a bit of a shake until the bubbles are at the top, and I'm then going to draw up to 1 ml. I'm now going to take off my drawing up needle and place it into my sharps container and pop my injecting needle on. From the chromal process, I'm going to be measuring 3 to 4 finger widths down, so the injection is going to be happening around here. Then going to, in this scenario I'm just going to use a sponge, so I'm going to grab my alcohol wipe and clean the area. I want to allow it a few seconds to dry before we actually give the injection, and I'm going to just get my gauze ready while we wait. Okay, so now I'm going to take the cap off the injecting needle, and what I'm going to do is I'm going to use a Z-track technique. So I'm going to pull the skin down like so, and I'm going to be injecting the needle at a 90-degree angle using a darting action, and I'm aiming to inject to 2/3 of the needle length. So you're going to feel a sharp prick. Okay, I'm now going to stabilize the needle. I'm going to draw back to make sure I haven't hit a blood vessel, and I'm going to inject the solution slowly over 5 to 10 seconds. Okay, and I'm going to pull the needle out, so that's all done, Stacey. And I'm going to massage the area and pop on some gauze here. And now what's going to happen is I'm going to be monitoring my patient for approximately 20 minutes for any signs of anaphylaxis or allergies, and I'm also going to record the time, so it's 3 o'clock. I'm going to record what medication has been given, so I've given sodium chloride and I've given 1 ml of it. I'm also going to record where it was given, so it was an IM injection into the deltoid. Okay, so I've arrived on scene to a patient who is unconscious and not breathing, so if I can get you to get the bag valve mask set up for me. I'm going to insert an OPA, and if I can get you to begin ventilations at 1 ventilation for every 6 to 8 seconds, please. I'm going to place our patient into the sniffing position by placing the towel under the head like so, and I'm going to get my test tube holder under here ready. I'm thinking about inserting an LMA. So to do this, I want to check that the LMA has a good seal on it. So what I'm going to do is I'm going to blow up the LMA. So this is a size 3, which will take 20 mils. I'm going to assess for any breaks in the seals. So I'm going to inflate the cuff, and I'm just checking to make sure that it's not deflating at all, and I'm happy that it's not. So I'm just going to remove some. I'm just going to slightly inflate it to make it easier to insert and prevent it from flopping back across itself. So I'm going to spray some lube just on the bottom side here so that the lube doesn't enter the airway. I'm just going to ask you to give me 3 nice breaths and then before I insert the LMA. Thank you. Take out my OPA and insert my LMA. So now that LMA is inserted, I'm going to pop in the rest of the ear, and I'm going to get you to take the mask off, and I'm going to assess for chest rise and fall. Also making sure that there's no stomach distension, and there's not, so if I can get you to keep ventilating at 1 breath for every 6 to 8 seconds. And now I'm going to secure the LMA. So I'm going to place the Thomas tube holder between the teeth, like so. Secure it and tie it up here. I'm also going to attach a face connector. So, and I'll get you to keep ventilating for me. So it looks like our patient is not needing the airway anymore, so I'm going to take off the Thomas tube holder and remove the LMA without deflating the cuff to prevent any substances entering the airway. I've also got suction here in case I require it. Okay, so I've arrived to a patient who is unconscious and not breathing, so I'm going to place them into a sniffing position. Can you get oxygen ready for me, please? I'm going to insert an OPA, and I'm going to get you to start ventilating for me at 40 to 60 breaths per minute, and I've got 5 centimetres of PEEP on there as well. So thinking about inserting an LMA, so what I want to do is I want to assess for any leaks or damage. So I'm going to blow it up, and I'm going to check that it's not deflating and that there's no splits or ruptures. I'm happy that there's not. So I'm going to remove the air, and for this patient I'm using a size 1 LMA because the neonate is under 5 kilos, so that's 4 mils of air. So I'm going to add a little bit of that air now, and I'm going to lubricate it on this tip here to help it into the airway and prevent it from curling over inside the airway. So what I'd like you to do, Stacey, is give me 3 good breaths and just count them out, and then I'll be inserting the LMA.
1, 2, 3.
Thank you. I'm going to take out my OPA now. I'm going to depress the tongue and insert the LMA like so. I'm then going to attach the rest of the ear in there. Pop this over. Can you attach the mask for me now, please? So I'm going to ensure that I've got adequate chest rise and fall here. I'm happy that I do, and I'm also making sure that I don't see any stomach distension, which I don't. Can I get you to carry on as you were before, please? So now I'm going to be securing the LMA, so I'm going to wrap it around baby's head and tie it up on the side. Tying it on the side makes it easier if it needs to be removed quickly. So now it looks like the baby is no longer tolerating the airway. So what I'm going to do is I'm going to untie my knots here, and I'll take the LMA out without deflating it, as it can cause saliva and things to fall back into the airway. Now we can continue giving the patient oxygen, just like so with the mask. I could also insert an OPA if my patient would tolerate it. I've got suction here beside me in case any aspirations need taken out of the airway.